Welcome everyone. Thanks again for talking about our platform. My name is Emmanuel. I'm your revenue cycle manager. I'm here to present to you another great video. This video is part of our revenue cycle mini clinics. My name is Emmanuel. Again, we're gonna go over some today presentation. We will be discussing national health expenditure here in the United States, as most of our work, our production is in revenue cycle. So therefore it's imperative that we understand the economy aspect of it, of the revenue cycle here associated with the US healthcare system. Again, this is Emmanuel. This is Star Healthcare. Thanks for stopping by the platform. In this platform, the goal is here to present you little videos like this, where you get an opportunity to learn, share some ideas, to network, and learn from each other. All right, let's get started. In this video, we going by CMS Fast Facts, which is for 2021. And we're going to look at some dollar amounts, some of the population, what CMS cover, and Part A, Part B, Medicare, Medicaid, and so forth. Let's get started. Here, what we're looking at here, it's a chart which is discussing here for 2021, the total monies contribute in the economy. We are to say it was $4.2 trillion, which made out of a total 18.3% of the US GDP. So if you were to look at the US GDP for 2021, we're talking about 23.5 to $24 trillion in 2021. The healthcare made out of 4.2 trillion. Now let's take a look at health insurance. Health insurance as a whole, you're looking at $3 trillion. Private health insurance, 1.2 trillion. Medicare, 900 billion. Medicaid, 734 billion. CHIP, 22.3 billion. DOD, Department of Defense, 4.3, about 44 billion, in Department of Defense, another $1.6 billion. Let's take a look at more data from CMS. This is 2021. We have to say Part A and Part B. When we look at what they say data of the population, so 63.9 million. Age eligibility enrollment, 55.9. Disabled, another 8 million. Together, 63.9. Let's look at the original enrollment, 36.4. MA and other enrollment, 27.5. Another MA enrollment, 26.9. And Part D, prescription drugs, which is about 49 million. Let's take a look at, now this was for Medicare, average monthly. This is Medicaid. Medicaid serve a total of about 82 million of the population. So altogether, as you can see, between Medicare and Medicaid, half of the population is being served by the government. Patients with dual eligibility, 11.6, 38, and 21 of adults. So children of adults, this is patient that's eligible for dual eligibility, meaning Medicare and Medicaid together. Okay? And if you're not familiar with what I'm discussing here, you need to sign up for one of my courses. We have a full service revenue cycle, and we have a lot of different trainings that we can, if you're a company that needs this sort of training, we'll be more than happy to assist you. And we love to train, and we love to take on new clients to service you if you need needs from a revenue cycle perspective. Let's take a look, more data. Now, we are to say here together, the programs payments was about 400 billions for both Medicare and Medicaid. And Part A, about 188 billions, and Part B, about 210 billion dollars. Let's take a look here. The original Medicare program, Part A, again, like we just discussed here, from a charts perspective, just so you can see. So it was about 131.3 in inpatient hospital, hospice care, home health agency, and skilled nursing. So a big portion of the Part A payments of the 187 billions went towards inpatient admission when admitted in the hospital while you inpatient. Let's take a look on the outpatient, Medicare Part B. So we have about $210 billion. Again, more than half is serving the physician and DME, which is, just about half, which is doing for the physician and durable medical equipment, which is about $120 billion. Let's take a look at some prescription facts here. Some prescription facts. We see here, there was a total of 48 million of, and then which now in terms of in billions, you have 104 billions total payments for the prescription drugs. It's 104 billion. So most of the drugs here, although some medical services in the doctor's office, Medicare Part B covers this, but some of the drug is covered by the private sector, Humana, WellCare, and so forth for the Part D drugs medication. Now let's take a look here. We're gonna take a look at, we did say the private sector was about $1 trillion. Let's take a look at the market share by health insurance. So here, and we are to say Anthem, 11%, Centene, 10%, United Healthcare, 9%, Humana, CVS, Kaiser, Molina Healthcare, Cigna. A lot of these might be not based on the region, part of the states that you are. Anthem is big here in the New England area. United Healthcare, Humana, CVS, Aetna. Kaiser used to be here back about 20 years ago or so, but they're no longer here. But they're probably more out west. Cigna is a great PPO network. They did some sort of collaboration with Tufts. Now, Tufts, who just recently joined with Harvard Pilgrim Health, now they are 0.32. So, but it's Tufts Health Plan, of course, which is a HMO here in the Massachusetts area, and to broaden their PPO network, they had to collaborate with different players such as Cigna. Now let's take a look at top 5 largest health insurance companies by membership. We have United Healthcare with about 70 million. Anthem Blue Cross, of course, with about 40 million. We have Aetna servicing about 22.1 million members. And Cigna, another 20 million, and Humana, roughly about 17 million. Again, the reason I bought this quick video is to educate you further into if these payers are the top payers who are the major players in the industry, then it's imperative that if they are one of your top payers in your area, you are to learn the member ID, the type of benefits they cover, and what kind of payment policies they have, and so forth. When I'm working with a client, these are the kind of data I like to analyze. I like to analyze whether your top insurance, your top payers, and to get an idea. So my research done prior of signing the contract, so I know who I'm serving and what kind of players that I'm dealing with, and so forth. Again, my name is Emmanuel. This has been another one of our mini clinic here at Revenue Cycle. My name is Emmanuel. This is Story Healthcare. We're here to serve you, train you, and so forth, and introduce you. I want to let me take a few minutes to let me take a few back step here and thank everyone who is not in the United States, whether you're in Bangladesh, India, Saudi Arabia. I've reached out to clients even as far as Qatar, who's interested, or maybe they have a company that's servicing. A lot of this is outsourced to different countries of such. And I want to thank them, Pakistan, India, and so forth, Philippines. And thank you for all the support and the kind words that you've showed here at Story Healthcare. We thank you. Again, until next time, and we'll continue to bring you video of such. Thank you. Have a good day.